So the other eye will be done by Dr. N.V. Arulmoji Varman sir. He's a medical director at Uma Eye Clinic, Chennai, and he was awarded gold medal during his MS at Madras Medical College. He started Uma Eye Clinic in 1984 at Chennai. He has trained over 200 surgeons in phaco across the globe and has conducted live surgical demonstrations in Russia and Vietnam. He is secretary and treasurer of Tamil Nadu Ophthalmological Association and member of managing committee for AIOS. His special interests are lies in phaco, multifocal IOLs, and glaucoma and refractive surgery. Over to you, sir. It's an honor to have you, sir, here.
Keep your eyes closed. You can relax. Open your eyes, please. You're doing very well. Look up. Look up. Excellent. Super. Beautiful. I'm putting a clamp to keep your lips open. Super.
So sir is just putting the drape and also speculum. So I'm just moderating this surgery. So in fact, sir is the only two surgeons in India already upgraded his Visumax 500 to Visumax 800. I was just talking to him and he was telling that a lot of advantages there with the Visumax 800. With there is no chance of suction loss. These are the few advantage have with the higher end machine, and also it has got a cyclotorsion compensation. Along that, within few days it may come with a hypermetropic solution. So I think with the fewer advantage, probably sir is the second person to install Visumax 800 in India. So over to you, sir.
Clean the area fully. Get rid of all the debris, and as Krishna Prasad already mentioned, you make the cornea dry as possible, but keep the keep the conjunctiva as dry as possible. The cornea still moist. Particularly the limbus should be dry. And ready. Then cone.
Hello, hello, hello. Who is there with the sound? May sound ka please increase the bass. Hello, hello, good evening, good evening. Hello, check, check, 1, 2, check. Hello, good evening, good evening.
Ready? Fluid. Saline. The cornea has become very dry now, so I am again moistening it. Drying the conjunctiva fully. Very light drying of the cornea, and we are ready to go. You'll see a green light soon. Keep looking at that. It'll come to you. Don't look down, look straight.
Look at the green blinking light. Can you see Rohan? Rohan?
Look at the green light, please. Excellent. Center the light.
On the hall.
Center the pupil. Beautiful. Good. Beautiful. Yes. Keep looking at the light. Beautiful. Light will become dim now.
At auditorium, can you hear us?
Yes.
Yeah, we can hear.
Yes, you're audible.
Rohan, can you hear?
It's a very nice, clean pattern. No dark spots. No OBL. It's fantastic. Now you come back on the white light. You're doing very well. Look at the center of the light. Sector. Whichever, doesn't make a difference. Can I have a forceps? To hold. I like to fold. I like to hold the conjunctiva when I do the dissection. That makes it a little more steady. First thing, you open up. The bubbles coming out is a good sign that says that the laser pattern was excellent. I opened the superior fully, just as Kudlu did. You can see the edge of the lenticule. Just go there, open the edge slightly, slip under, and open the inferior. Just as Kudlu did, open the inferior, a small area alone, maybe 25% of the area. 75% is the opening of the anterior. Once we confirm the anterior and posterior clearly delineated, go with the blunt dissector and just do a windshield wiper. I like to go to the very edge, come back. Usually it's about 3 or 4 strokes. You opened up the whole anterior cap. Now slip inferior. Here I do a slightly different technique from Kudlu. I open up to the edge, but I don't open the edge. I stop short of the edge. Now it's all completely separated, the edge is not. Then I poke out at 12 o'clock and open the edge, leave one small bit here. I leave one small bit, go to 11 o'clock and cut across. At this point, I go cut this, so it's completely separated. So that way no chance of folding over or tearing of the lenticule. Look straight, please. You can go in with the second instrument and out it comes, whole with minimal dissection pressure. Moisten the cornea. Irrigating under the cornea in the bed is a good idea, but not mandatory. Then, just as Kudlu said, massage well, gentle massage. If the corneal epithelium is wet and lubricated, you can be sure that you will not cause any epithelial issues. So this is very beautifully lubricated. There ends the story. So smile is quite easy to perform. All we need is perfection at every step. The advantage of the patient is many. Lack of the very fact that there's no flap is very comforting to the patient. Antibiotic drop, please. So the patient can get back to normal activities in 24 hours. They can even have a head bath, they can even put eye makeup, get a facial done, get back to computer work, anything. Any physical activity is not limited. You cannot have any flap-related complications. Ectasia is lesser. Quality of vision is superior to what you would get with LASIK. So in every way you look at it, smile scores over LASIK. Thank you so much.
Thank you.
Yeah.
Thank you so much, sir.
Rohan,
Yes, sir.
yeah, just to tell you that I think you know that most of the machine in the coming days with a flapless procedure. So what I want to say that the refractive surgery in coming days is there is no flap. Smile or PRK. This is the only 2 treatment going to stay back in refractive surgery. But once again, PRK has got its own disadvantages. Higher refractive error you cannot operate. Higher refractive error you cannot operate PRK, and the patient pain management. In spite of you soak the contact lens with the ketorolac, still patient will have pain. If you ask me, I think more than -3. My first line of choice treatment is smile. Excellent treatment. Only thing is, some people have some learning curve, but once you become the best, I think you can do whatever you want. I think Dr. Gaurav is going to show you hydrolenticular extraction also. In the end, principles are very simple. You are just intraoperative preparation not important, pre-operative preparation, that keeping the conjunctiva dry, keeping the cornea semi-moist, and especially cleaning all the whatever the debris and secretions are in the conjunctiva, you have to clean it well. Draping is very important. You need to have a clear access of the eye, then you come out with a very good results. And I have done, I think, more than 1,000 plus cases within the last 3, 4, 5 years. Not a single patient has come back to me with the ectasia. Even I think Dr. Arun Mozi Varman do agree with me. Chances of ectasia is almost next to zero with smile. Probably the coming days, every company may come with this flapless procedure, and I think there is the day only with for any refractive, any company, the mode of treatment will be flapless, whether it is either PRK or smile. Any questions, Rohan?
No, sir. I think the next surgery is ready.
Yeah, thank you so much. Thank you once again, the whole Uttarakhand Society, for this opportunity. Thank you, one and all.
Thank you, sir.